The 21st century has seen a number of breakthroughs in the fight against cancer, but this disease remains one of the biggest killers, leading to almost 10 million deaths worldwide in 2020, according to the World Health Organization. Retinoblastoma is an eye cancer that's mainly seen in children. It's one of the rarer cancers today, but it's quite prevalent in Nigeria. Unfortunately, advanced treatment options haven't been available, with eye removal procedures common, leading to several children losing their sight. But that's changing as the University of Ilorin Teaching Hospital, Medical Foundation IRDOC, and First Cardiology Consultants Hospital have partnered to provide the first intra-arterial chemotherapy procedures in the country. IAC is able to treat the cancer directly in the eye, making treatments more effective.
We see about 450 cases a year, which is quite common compared to most Western countries, so it's really an epidemic. It takes a lot of skill to be able to do interventional radiology, and now we're starting to have more people trained in interventional radiology. One person just came back from a program in Tanzania, so we're starting to have the human capital, right? And basically human capital is basically being the main thing.
Through IRDOC, the cost of these first two procedures has been covered. IAC is rather expensive, with prices ranging from country to country, but costing thousands of dollars.
In America, an IAC treatment for each time you do it is about $22,000 to $25,000, okay? So in Nigeria right now, we're costing the procedure for about $3,500, but that's night and day compared to America, but that's still very expensive for Nigerian families. When the procedure has been made available in country, that's a big step, right? Because if you think about it, $3,500 is probably what it costs for the family to travel to America, right? For a mom and child to travel to America, to travel to India, to travel to all these countries. So we've already significantly reduced the cost for the family to get it done here. But again, I'm still not naive about the fact that it's still expensive.
One of the patients is just 18 months old. His mum said his symptoms started when he was 7 months old.
This is congenital cataract. They can be corrected at any time. But I was too bothered and worried. I decided to move to the state capital, that's Jalingo, where the ophthalmologist there at the FMC told us that it's retinoblastoma, but they can't treat it there because they don't have facility. My hope for Joseph is he will regain his sight, his vision will come back to both eyes.
Fortunately, both surgeries were successful. Ocular oncology specialist Professor Ido Didi Fabian, who came into Nigeria to join the team, is hopeful that this procedure can be done independently in the country going forward.
Historically, the main procedure was enucleation, removal of the eye. Then for many years, we used radiotherapy until the 1990s, and then we moved to intravenous, to systemic chemotherapy, which is still the mainstay of treatment across the world. Since the early 2000s, in different places across the world, in high-income countries mainly, we use IAC. It's more sophisticated, more complicated. The logistics, it's more expensive, but the efficacy is really great. So you can really save vision, eye, and life of a child using this treatment. This specific procedure is very high-tech, and it's done in most high-income countries, in North America, in Europe, in Israel. Only a few countries in Africa use it, and now we're glad to say that Nigeria can use IAC.
Healthcare in Nigeria is progressing particularly through the private sector. Procedures and treatments that were only available abroad just a decade ago are slowly becoming accessible. Dr. Hamed Ninalawo moved back to Nigeria a few years ago, and now he's saving the lives of retinoblastoma patients through IAC. While the high number of medical professionals leaving Nigeria is a steep hurdle to overcome, stories like this offer a slight glimmer of hope for the advancements of healthcare in the country. Laila Johnson-Salami. Arise News, Lagos.